Well, I always get a kick out of this conversation because California has two single-payer systems. Medicare is a single-payer system. 6.5 million Californians are on Medicare. It's a single-payer voucher system. Anybody here on Medicare? I will be in 2 years, right? I regularly like to tell my students who are like 20 that they'll be paying for my health care in a couple of years. I'm already benefiting from that 3-to-1 underwriting ratio, I point out to them. So you got 6.5 million people already under a single payer system with negotiating leverage that Senator Monning talked about. And then you have another 14 million that are on another single payer system. It's known as Medicaid, single payer with negotiating leverage. Now, Congress prohibits Medicare from negotiating volume discounts with pharmaceutical companies because pharmaceutical companies have so much influence over Congress. That's one thing that you could benefit. And now the rest of Californians are covered by either employer-provided health care, it's probably true of most of the people in this audience, who get an enormous benefit worth about it costs the federal budget about $250 billion a year because the health care your companies provide you is not taxable income to you. So that's tax-free income to you, and your companies get to deduct it. So if you really wanted to do something about health care in the United States, if I had a magic wand, well, if I had a magic wand, first of all, I'd get Harry Truman back. You know, you've heard of the military-industrial complex? Well, the healthcare industrial complex today in the United States is twice the size of the military-industrial complex. The federal and state governments will spend $1.3 trillion this year on Medicare and Medicaid, not even including the VA. That's twice what we spend on military contractors. And you may remember Truman, when he was still a senator, when we got involved in World War II, created the Truman Committee to go after all the profiteering being done by military contractors with the United States government as we prepared before December of 1941 for war. Well, the same thing right now should happen with healthcare. They're getting $103 billion this year. The nonprofit hospitals and profit hospitals, doctors, nurses, pharmaceutical companies, and medical device manufacturers, we need a Truman Committee that gets outcomes from them if they're going to get that kind of money, because we are not getting the outcomes. And the problem is, these guys will know it because they get enormous pressure. Healthcare companies and associations, never forget the AMA and the Nurses Association and others, spend $500 million a year lobbying Congress and state legislators. So I would, this notion of having a single payer system that's going to make a difference, the only way that you will end up solving this problem if you're going to have a government entitlement to health care, if you're going to talk about Canada, then you're going to talk about rationing. They have death panels. And frankly, I'm in favor of Medicare for all, and I'm in favor of death panels. But don't fool yourself into thinking that single payer without rationing is going to somehow solve health care in the United States. End-of-life care costs an absolute fortune. We have a fee-for-service system. How many people in this room probably work for hospitals or are doctors or others who know that you get more money every time you do a procedure, and it's not that you're a bad person, that's just the nature of the incentives in this system. Unless you're in Kaiser, people are going to be incented to spend money all the time. So single payer doesn't solve anything.